بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is another episode of Learning Radiology Flashcard entitled Chest Wall Mass. What are the common causes of chest wall mass? We have common causes and we have less common causes and some rare causes. The common causes, we can differentiate it to soft tissue masses like Neurofibroma, Schwannoma, Hemangioma, Lipoma. Osseous masses, we have the Chondrosarcoma, Myeloma, Fibrous Dysplasia, Osteochondroma, and we have the metastasis. What are the least common causes? Also, the least common causes can be classified to soft tissue causes like soft tissue mass lesion like elastofibroma, dorsifibromatosis. Also, we have the osseous osteosarcoma, like Ewing sarcoma, giant cell tumor, and aneurysmal bone cyst. Also, we have the secondary invasion. Rare causes, we have some rare causes, but are important and should be kept in mind, like lymphoma, liposarcoma, angiosarcoma, malignant nerve tumor, and radiation-associated malignancy. Let us see some examples of this chest wall mass. Here, this patient with hemangioma, as we see here in this axial T1 contrast fat set MRI patient with chest wall mass and with here heterogeneous mass lesion, and this is the fat. This is a stab image of the same patient, and the lesion is lobular, and it is demonstrate high signal intensity in the fluid sensitive sequence, as we see here. Here, this patient with chondrosarcoma, and we see here in this patient about 29 years old, and we see the calcification in the mass lesion in the anterior chest wall, and demonstrate these mass lesion demonstrate calcification, rings, arcs, and stable pattern of calcification, and this is consistent with chondrosarcoma. Another patient with chondrosarcoma here with MRI, and we have the T1 as we see low signal intensity mass lesion, and here the T1 with fat set, and we see the nodular enhancement of the ring of the mass lesion. And also this is the same patient, and we see high signal intensity similar to CSF fluid, and this is characteristic of the sensitive sequence of high cartilage tumor. This is very characteristic. And this is another patient with myeloma, as we see here in this T1 fat set, expansion of the rib, of the chest wall, similar intensity to the muscle, and with contrast, the mass shows homogeneous high signal enhancement. And also the myeloma in this patient with the stare image, high signal intensity of the lesion. Untreated myelomatous lesion typically demonstrate this appearance with low signal on T1, high signal in T2, and enhancement following the administration of contrast. Here, another patient with mass lesion as seen here, and this is aneurysmal bone cyst, and demonstrate ill-defined mass in the lower thoracic spine and high signal uh, in the signal intensity relative to the muscles. Here, this is the same patient with a fluid level demonstrating in the aneurysmal bone cyst. Here, another patient with secondary invasion, and we see here T1 contrast fat sat. Patient, we have upper lobe mass lesion cancer, demonstrated homogeneous enhancing mass with multifocal invasion of the chest wall, as we see here. Here, another patient with liposarcoma. In this patient, we see this is a CT scan, and we see soft tissue in the lipomatous tumor and here, and this is consistent with liposarcoma. Another patient with liposarcoma, and this patient large heterogeneous mass in the chest wall with high signal intensity representing fat. Here, another patient, we have patient with soft tissue mass anterior amalgamated with muscle, and this mass, it is proven to be Hodgkin lymphoma. Here, another patient, as we see here, mass lesion with ill-defined border in this area, and we see here the mass on the CT scan, and the mass on the CT scan heterogeneous enhancement, and on biopsy it is a renal cell carcinoma. Here, another patient with Ewing sarcoma, and as we see here, we have chest wall mass involving the chest wall anteriorly, and this is the CT scan with the mass. It shows heterogeneous with some mineralization and some necrosis in the center and soft tissue component here. Here, another patient with chest wall mass, and we see here in the lateral chest, we see a rib destruction, and that rib destruction demonstrated by CT scan also, and the patient has hyperparathyroidism, and this patient, it is a brown, and this patient has a brown tumor with known history of hyperparathyroidism and renal osteodystrophy from chronic renal failure. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.